Good evening, everyone. I'm going to give it about 60 more seconds and then we'll get started. We've still got people logging in. All right. Well, good evening. Thanks again for joining us for part 3 of our 4-part Medicare 101 series. Hopefully everybody can hear me all right. If you can't, please just pipe up and let me know by either unmuting or typing into the chat box, and we'll see if we can't fix that. Tonight, we're going to talk about Medicare Part D. I will pause during the presentation to see if there are any questions. If you do have any questions, you are always welcome to either unmute at the pause, or you're welcome to type your question into the chat box at any time, and I will address them at the pause. I think that's all the housekeeping, so we will go ahead and get started. So, welcome to part 3 of our Medicare 101 series. Again, tonight we're going to talk about Medicare Part D, or the prescription drug coverage benefit for Medicare. Hopefully everybody received the email that I sent handouts for tonight's presentation about an hour and a half ago. If you did not, you can always just let us know by emailing me or our IT people through the link for this presentation, and we're happy to send them again. We're going to start with who I'm with. I am with the Pikes Peak Area Agency on Aging through the Pikes Peak Area Council of Governments. And the mission of the Area Agency on Aging is to coordinate with our regional entities to develop programs and systems that allow people to stay in their homes for as long as possible. The Pikes Peak Area Agency on Aging serves 3 counties of Colorado: El Paso, Park, and Teller. I am also with the State Health Insurance Assistance Program, or SHIP program. The SHIP program is a federally funded nationwide program that's designed specifically to provide unbiased education and information at no cost to beneficiaries, family members, and caregivers, or any interested parties. And we can help people understand all parts of Medicare, including Medicare A, B, C, and D, all of the insurance options that might be available to go with Medicare, as well as we can help people understand or see if they qualify and help them apply for any assistance programs if they are low or limited income. The SHIP program through the Area Agency on Aging actually serves a total of 9 counties in Colorado. I've listed our local Colorado Springs number on this slide, as well as the statewide toll-free number. If you call the statewide toll-free number from anywhere in Colorado, it will automatically route you to the SHIP office closest to your location. Every county and every state has access to a SHIP program, at the very least by a toll-free statewide number. Also, just an FYI, the ACL, or Administration for Community Living, is currently doing an ongoing nationwide survey of the SHIP program. And so if you receive a phone call asking you to do a survey about the services that you were provided through this SHIP program, I just want to let you know that it is a legitimate phone call, and we would encourage you and appreciate any responses to that survey. It certainly helps the funding for this program and helps us improve our services. The funding for this program has actually not gone up with any significance in the last 7 or 10 years. So anything that we can do to help improve this program and the funding to make it more readily available for consumers is always appreciated. So just a quick review of the topics we've covered already. Week 1, we covered Medicare eligibility, enrollment, and benefits for Part A and Part B. Last week, we covered the insurance options that are available to go with Medicare, specifically Medigap and Medicare Advantage plans. And again, this week, we're going to talk about drug coverage, Medicare Part D. So Medicare Part D is honestly the newest and most significant benefit in addition to Medicare in a couple of decades. Part D came into effect in 2006. Prior to that, Medicare did not have prescription drug coverage. All prescription costs were the responsibility of the beneficiary. Part D is provided to give you prescription coverage on an outpatient basis only. So basically, it's only going to provide you coverage for prescriptions you have to go to the pharmacy and pick up. Under the Part D plan outline, all Part D plans must include a range of drugs in a range of drug categories. So each plan will have a different list of drugs, which we will talk about in detail, but they are required to have a minimum set of values. So they have to have a minimum amount of drugs from each drug category, that kind of stuff. Most Part D plans, if you buy a standalone plan, will have a monthly premium. Any Part D benefit, regardless of how you get it, will usually have a deductible and will always have copays. However, there is financial assistance available on Part D benefits for people who have limited or low incomes. And we're going to talk about all of that in detail. But let's start with whether or not you should even enroll in a Part D. As with all Medicare benefits, whether you realize it or not, all Medicare benefits are optional. There is nothing that says you absolutely positively have to enroll in any part of Medicare for any reason whatsoever. However, if you don't enroll when you first become eligible or during the other enrollment periods that we've talked about in the last couple of weeks, and you choose to enroll later or in the future, penalties can be associated with that late enrollment. The same can apply to drug coverage. However, just like with the other parts of Medicare, there are some exclusions for that penalty. For example, if you are currently covered, say under an employer plan, if you are a veteran and you access the VA pharmacy, those kinds of drug coverage would allow you to delay or choose not to enroll in a separate Medicare Part D plan, because those forms of coverage can be considered what they call creditable, meaning they're as good as or better than what Medicare Part D can provide. And so you wouldn't need to purchase an additional Part D plan. If for some reason those benefits were to terminate in the future, because they are considered creditable, you can enroll in a Part D when you lose those benefits without any penalty. A lot of retirement plans, health benefit plans can include credible drug coverage. Again, the VA pharmacy benefits can be considered credible drug coverage. If you choose not to enroll in a Part D plan simply because you don't take any drugs, although that's a very legitimate argument, unless you choose not to enroll in a Part D plan because you have other drug coverage that is considered creditable, if you choose to enroll in a Part D down the road, there could be penalties associated with that. The other things you'd want to take into consideration are how good the drug coverage you have is if you have other drug benefits. So if you do have a retirement health benefit that includes a drug benefit, is it saving you as much money as a Part D plan would? Is it costing you more money than a Part D plan would? Are you paying higher premiums than you would with Part D? Those are things that we can help you determine in a one-on-one consultation. But again, if you choose not to enroll in a Part D and you don't have other credible drug coverage, you would be allowed to enroll in a Part D during any open enrollment in the future, but you may be assessed a penalty for not having some sort of credible drug coverage in the meantime. Times to enroll in Medicare Part D are going to be pretty much the same times that and enrollment periods that we discussed in the last couple of weeks, starting with your initial enrollment period into Medicare. So when you are just becoming eligible for Medicare and enrolled in Medicare, you have the same timeframes or extended timeframes for other options to enroll in coverages to go with Medicare so that they all start at the same time. So the same enrollment period for a standalone Part D plan is the same during your initial enrollment period, the 3 months prior to the month of your initial enrollment or 65th birthday, the month of, and then up to 3 months after. Part D plans are subject to the annual election period, what we also refer to generally as open enrollment. That's the October 15th through December 7th timeframe every year. And again, during that timeframe, you can get into a Part D plan, you can get out of a Part D plan, or you can switch from one plan to another. Any changes you make during the open enrollment period go into effect January 1st. And then there's always exceptions to the rule or special enrollment periods that some people may fall under. Again, that's going to be losing other credible drug coverage that you may have had through, say, a retirement benefit or something like that. Anytime you lose coverage that's considered as good as or better than what Part D can offer involuntarily, meaning it wasn't your fault, you would always have the opportunity to be able to buy a Part D plan whenever that occurs. Again, mentioned the penalty. The way the Part D penalty, D as in drug, is calculated is different than the way the Part B as in boy penalty is calculated. Part D penalties, if they're incurred, are going to be calculated by adding together months. So they're going to penalize you 1% for every month outside your initial enrollment period that you were without Part D or other creditable drug coverage. And that penalty is going to be based on whatever the national average Part D premium is the year that you decide to enroll. So for example, if you were eligible for Medicare in 2020, January of 2020, but you didn't take any medications, you didn't feel the need to spend the money on a Part D plan because you don't take any drugs, but you decide you want to enroll for 2022 or 2023, you would have to wait for this upcoming open enrollment period to start in October of this year. Coverage would start in January, but the penalty amount is going to be calculated based on how many months have passed since you were first eligible for Medicare and when your Part D plan goes into effect. So potentially you could be looking at a 24% penalty for 24 months without any coverage. That 24% would be multiplied by the national average Part D premium, which for 2022 is $33.37. So they've multiplied 24% by $33.37. Whatever that comes out to would be tacked on top of the premium for whatever plan you chose to enroll in. And again, Medicare penalties last forever. So that would be a monthly penalty on top of your premium every month forever. So again, as with Part B, I encourage people, if you can avoid incurring a penalty of any kind, that's always your best way to go, because it doesn't sound like a lot of money at first, but over the rest of your lifetime, it can add up quite a bit. Again, the exception to that penalty would be as if you had other creditable coverage before you enrolled in Part D, such as a retirement and health benefit, active employer health coverage, or maybe even the VA pharmacy. For those who have limited or low income and can qualify for financial assistance, also referred to as extra help for Part D, penalties would not apply. So if you qualify for financial assistance and you've incurred a penalty, the penalty would not apply because you qualified for financial assistance. All right. Part D premiums, just like Part B as in boy premiums, are means tested, meaning they are adjusted based on annual gross income, also referred to as IRMA, income-related monthly adjustment amounts. So what that basically means is the more you earn in annual income, potentially the higher your Part D plan premium can be. And this would be not a penalty. This would just be an income adjustment. The threshold is the same as it is for Part B. So an individual would have to have an annual income of more than $91,000 a year before they'd have to worry about paying a higher Part D premium. The adjustment or the income limits are listed on this slide, as are the amounts for the higher Part D premiums if you had to pay them. The amounts listed based on the income would be in addition to whatever Part D premium you choose to pay once you enrolled in a Part D plan. And Part D premiums can vary significantly. In Colorado this year, we have a plan with a premium as low as $5.50 a month. And we have plans whose premiums are over $100 a month. So it really depends on what Part D plan you enroll in. But the adjusted gross amount, the IRMA amount would be tacked on top of that. I'm going to pause here to see if there are any questions. Again, if you have a question, you can simply unmute and ask it or type it into the chat box. All right. I'm not seeing any questions. I'm not hearing any questions, so we will move on. Now we're going to talk about how Part D works. So basically, Medicare Part D has a basic outline of coverage, meaning there is a standard plan, which is the minimal level of benefit any Part D company, any Part D insurer can offer you for coverage. Most insurers do better than this basic outline, but as long as they meet this minimum basic outline, they are considered a legitimate Part D plan provider. The basic minimal outline for Part D coverage from any Part D provider states that there will typically be an annual deductible. For 2022, that Part D annual deductible is $480. What that means is if you have a plan that has a deductible, what that means is once you enrolled in that plan and you go to the pharmacy to start using that plan, the plan is going to make you pay $480 in retail cost for your medications to meet your deductible. Once you've spent $480 out of your pocket in retail prescription costs, you've met your deductible. Next time you go to the pharmacy, your out-of-pocket cost for your prescription should be significantly lower in the form of a copay. That lower cost is supposed to represent approximately 25% of the cost of retail. So once you've paid 100% in retail cost and spent $480, the next time you go to the pharmacy, your cost should be only 25% or less of retail for the cost of that drug. While you're paying full retail price to meet your deductible, while you're paying only 25% of the retail price after deductible in the form of a copay, what Medicare and your Part D plan are also doing is they're taking the cost of everything that you purchase every month and they're adding it up in the column back here. So every time you go to the pharmacy and pick up a prescription, they're taking the full retail cost of that prescription and adding it up in this column. When the numbers in this column reach a maximum of $4,330, you will have hit what they call the coverage gap, or what used to be known as the donut hole in your Part D coverage. In the past, when you hit your donut hole, what that used to mean is that you would have to go back to paying 100% full retail price for your drugs and still have to pay your premium for the plan. Over time, what has happened is that the government decided to start closing that donut hole and reducing your liability once you hit that coverage gap or donut hole limit. As of 2020, the government considers the donut hole closed, meaning your cost once you hit this limit has been reduced as much as it's ever going to get, and it will not go back up. So what happens when you hit the donut hole is your cost at the pharmacy will continue to be at 25% for brand name drugs and generic drugs of retail price. And you may be asking yourself, well, how is that different before I hit the coverage gap or the donut hole when I was paying 25% of the retail price of my drugs? Well, the difference comes in the way they calculate these costs. So for most Part D plans, I said that this was a basic standard outline, and most Part D plans did better than this outline. So for example, after deductible, your plan may charge you a $0 copay or a $1 copay for a generic drug. If you hit the coverage gap or the donut hole, that $0 or $1 copay for that generic drug may increase to 25% of retail cost. So any reduced amounts, any amounts less than the 25% after deductible that you pay at the pharmacy, that less than 25% may increase up to 25% if you hit that coverage gap or donut hole. While you're in the coverage gap or that donut hole, Medicare and your plan are still continuing to add to the numbers for every medication you pick up in this column over here. However, to get you to this coverage gap, they were always adding the full retail cost of everything that you purchased through your Part D plan to this column. Once you hit the coverage gap, they're going to continue to add costs to this column, but now they're only adding what you're paying at the pharmacy, which is 25%. If somehow your medication costs manage to total up to, based on those calculations, a total of $7,050 altogether within a calendar year, you would reach the other side of the donut hole or coverage gap, and you would enter in what they call catastrophic coverage. If you reach catastrophic coverage within the calendar year, based on the cost of your medications, your copays at the pharmacy go down again to either 5% of retail or a copay of $3.95 per month for generics or $9.85 per month for brand names. And that would continue until the end of the calendar year. And then come January 1st, that cycle would start all over. Fortunately, most people will not hit the coverage gap, but some people may. So it's important to understand why costs may go up or down throughout the calendar year. Again, this is the basic standard outline of coverage. This is the least amount of benefit any Part D plan can offer you. And most plans do better than this. As far as what is covered, the coverage minimums for Part D plans, Medicare has decided that any company that is selling coverage as a Part D plan must cover at least 2 medications in every medical class of medication. So for example, if there are 20 different drugs on the market for high cholesterol, as long as a Part D plan covers 2 out of those 20, they're meeting the Medicare guidelines. And that applies to every class of medication. If a company chooses to offer more than 2 options, they can do that, but they have to offer a minimum of 2, regardless of how many on the market. There are some classes of medications that every plan is required to cover any and all drugs that are available in that class. There are a total of 6 classes that falls under, where every company has to cover any drug available under that class for medication. And that includes antidepressants, antipsychotics, anticonvulsants, antiretrovirals, immunosuppressants, and antineoplastics. In order for a drug to be covered by Part D of Medicare, that drug has to be approved for use by the FDA, and it has to be prescribed for its medically intended purpose. What that means is, Let me give you a common example. If a doctor is trying to prescribe Viagra for blood pressure issue, because that is not what Viagra was intended to be used for when it was created, excuse me, it would not be covered under Part D for that use. So the drug has to be approved by the FDA and it has to be prescribed to you for what it was created and intended to be used for. All plans must also cover drugs, including biologicals and insulins, and the supplies for injecting insulins, including the syringes, the needles, the alcohol, the swabs, all of that. Excuse me. And all plans must include both brand name and generic drugs on their formularies. Now, what I can tell you about that is if you are currently taking a brand name prescription and halfway through the year, that prescription is suddenly available as a generic drug, I'm pretty sure you're going to get a notice from your plan that says, we're no longer going to cover the brand name drug. We're going to ask you to start taking the generic drug. And yes, they can do that as long as they provide written notice in advance. Some plans may not choose to switch to the generic until the next calendar year, but just be aware of that. If any brand name drug switches or becomes available as a generic over the course of a year, you could be notified of that change. As with all parts of Medicare, there are some things that it will not cover under Part D. So for Medicare Part D, the things that it will not pay for are any drugs that have already been covered or would be covered under Medicare Part A, such as any drugs we receive in a hospital during a hospital stay, or any drugs that would be covered under Medicare Part B. And that would include things like chemo treatments and dialysis treatments and stuff like that. Part D also does not cover anything considered over the counter or without prescription written requirement. Even if it is required to have a prescription, if it's specifically used to treat anorexia, if it's specifically for fertility purposes or for cosmetic purposes only, it would not be covered under Medicare Part D. Even if it requires a written prescription, if it is solely and specifically to treat cough and cold symptoms, such as guaifenesin or Robitussin, it is not covered under Medicare Part D. And again, over-the-counter stuff or even many vitamin and mineral supplements that may require a prescription are not going to be covered by Part D. There are some exceptions to that rule for vitamins and minerals that might be prescribed to treat very specific diseases. So that's really the basis of Medicare Part D. Any questions about any of that so far? Again, if you have a question, you can simply unmute and ask it, or you can type it into the chat box. I do have a question in the chat box. Is the deductible, is this a yearly annual deductible for Part D drugs? Yes. So the deductible is applied on an annual basis, which will start January 1st every year. If you enroll in a Part D outside of January 1st, because say you don't become eligible and enrolled in Medicare until June. When you enroll in Medicare in June and you enroll in a Part D in June, that deductible will start in June. If you meet that deductible before the end of the year, come January 1st, that deductible will renew if you have one. Now, not every Part D plan is going to have a deductible, but most of them will. So if you can find a plan that has no deductible, they pay it for you, that is going to be your best option for drug coverage that year, that's great. Because there are some plans that pay the deductible for you, but most of them will make you pay that deductible, and it does renew January 1st every year. Any other questions? So let's talk a little bit about let's talk a little bit about the best way to find a Part D plan. Well, no, let's talk about extra help first. So again, I mentioned that there was some financial assistance programs available for people who have limited or low income to help with the costs of Part D, such as the premiums, the deductibles, and the copays. That help is called low-income subsidy, but it's typically referred to as simply extra help. The extra help benefit or assistance is actually applied for through Social Security. So this assistance comes directly from Social Security. It is provided automatically to people who are already eligible for other financial assistance programs, such as the Medicare savings programs we've talked about in the last couple of weeks, or for people who are on SSI, supplemental security income. There are several different levels of assistance available for Part D extra help, and that is, of course, going to be based on income and asset limits. To apply for this extra help on Part D benefits, again, that's through Social Security, and you can do that at the Social Security website, ssa.gov, or you can do it by calling 1-800 number for Social Security, the toll-free national number, which I've listed on the slide, or you're always welcome to call your local SHIP office. We're happy to help determine eligibility, and if eligible, we're happy to help with the applications, and that can be done over the phone. Income limit maximums are listed on this slide. So for 2022, a single person can have a maximum monthly gross income, pre-deduction income from any and all sources. So it's total income of almost $2,000, $1,974. A couple's max income would be $2,653. Again, these are pre-deduction dollars. Asset limits are higher for this assistance as well. A single person can have liquidatable assets, not count your car, don't count your home, don't count your personal property. What they look at is financial accounts, banks, annuities, IRAs, property you don't live on, that kind of stuff. Asset limit for a single person, $5,510, for a couple, $30,950. If you feel that you may fall within these guidelines, again, give us a call 1-800-MEDICARE, or go to the Social Security website and do an application. These are the high-end income limits. So the higher the income within these limits, the less help you get on your Part D costs. But any assistance you qualify for eliminates your increase in cost in the coverage gap. So it makes it so you never have to pay the full 25% of retail for your medications. So it is worth applying for. And it can also reduce your deductible from the $480 to a maximum of like $98 this year. So again, it is worth applying for. Even if you're maybe borderline and not sure, give us a call and we can help you determine your eligibility. And again, we can help you with the application. For those who may still be struggling because of the cost of their medications, but don't qualify for the extra help, there may still be assistance available for your pharmacy costs. And that's typically going to be through a patient assistance program. A patient assistance program is typically an assistance program that's made available directly from the maker of the medications, the drug manufacturers. Drug manufacturer patient assistance programs tend to be much more generous in their income and asset limits for people to qualify. Some programs may not go by income and assets. I know that there are a couple of programs that you simply have to prove that you've spent $600 on a drug in a calendar year, and you would automatically qualify for assistance for the drugs that they make. So it really varies from company to company, manufacturer to manufacturer, and it really depends on what medications you take as to whether or not there might be patient assistance available. Typically, patient assistance is going to be for brand name, more expensive drugs. If you're already taking a $10 generic drug, it's not likely that there's going to be patient assistance available for it. But that's more likely that you're going to have a much lower out-of-pocket cost through a Part D plan on a drug like that. If you take a $600 a month drug, brand name drug that's new on the market, it's very likely that there is a patient assistance program available for that medication. I've listed some websites that you can go to look up whether or not any of your medications offer a patient assistance program through the makers of those drugs. Medicare.gov can provide that information in the plan finder, which we're going to talk about next. I like to use rxassist.org because if you find assistance programs through that website, you can also download the actual applications for that patient assistance program as well. Any questions about any of that? You guys are awful quiet tonight. All right. I don't see any questions in chat, so we'll move on. All right, so things to consider and how are you going to best find the Part D plan that's going to fit your needs for the least amount of money? So in Colorado for 2022, there are a total of 20 different Part D plans to choose from that are just Part D. There are also about 45 or 50 Medicare Advantage plans that include a Part D benefit. Whether your Part D coverage comes as a standalone plan, just drug coverage, or your benefit comes as a Medicare Advantage plan benefit, the all-in-one package, it works the same way. The only difference between the standalone Part D plan and the Part D benefit you get in Advantage plan is you don't pay extra to have it in the Advantage plan. So if you enroll in an Advantage plan, again, that's going to provide your Medicare Part A, Part B, and Part D benefits all rolled up into one package under one private insurer. If you have original Medicare, you choose to buy a Medicare supplement or Medigap to go with your Medicare, you would have to purchase a standalone Part D plan in addition to those in order to have drug coverage. So it's two separate methods of getting that coverage, but it works the same way and follows all the same information that I just covered, regardless of which way you go. Things to consider when you're looking at Part D. Obviously, premium costs are going to be consideration. You absolutely want to make sure that whatever Part D plan you are enrolled in covers the medications that you take. It's very, very important. And because we have the ability to look specifically at all the plans and whether or not they cover someone's specific medications, it's absolutely important that you find a plan that covers everything that you need it to cover. And then the last consideration is likely going to be your copays, your deductibles. How much is it going to cost you when you go to the pharmacy to pick up your medications? How are you going to find that information out? When there's 20 plans to choose from, every one of those plans is going to have a different list of medications based on the way Medicare requires that they cover medications. So every plan is going to have its own individual formulary or list of drugs that they will cover. And again, as long as the drugs on that formulary meet the Medicare criteria, every plan can have a different list of drugs. So you want to make sure your drugs are covered and that your drugs are on the plan's formulary. You're going to want to make sure you're getting the best coverage for the least amount of out-of-pocket cost and premiums and deductibles and all of that kind of stuff. You can do that a couple of ways. You can either call every one of those plans individually and ask them if they cover your drugs and then what the copays would be, what the deductible would be, what your premium would be. You can call an agent or a broker and ask them to do that for you. Or you can do the most effective method, or the most effective option would be to go to the Medicare.gov website and use the tool that Medicare has created to help you make that decision. So Medicare's website does include a search engine. They call it the Medicare Plan Finder. And the Plan Finder is basically designed to allow you to input all of your specific medications, name, quantity, dosage. It allows you to enter up to 5 pharmacy preferences, and it will take all of that information and compare it to the 20 standalone plans available. And the end result is that it will list all of the plans in order of the plan that would save you the most money on your specific medication needs at the top of the list, to the plan that would cost you the most money out of pocket on your medication needs at the bottom of the list. So basically this search engine, this Medicare Plan Finder, does all the work for you. All you have to do is type in the information. Again, it's supposed to be pretty user-friendly. I can't tell if it's user-friendly because I've been doing this a long time and I've seen this Plan Finder evolve over the years. We do help and are always happy to help people with using the Plan Finder, learning how to use the Plan Finder, walking you through it, or simply running it for you and giving you the end result. We're happy to do that at any time. Again, Medicare does encourage you to create an account on the Medicare website. Used to be referred to as a My Medicare account. I think they've kind of scrapped that My Medicare part, but they still encourage you to create an account. There are benefits to doing that. If you have a personal account on the Medicare website, you would be able to go into that account and look at any claims that have been submitted to Medicare by any of your providers. It will save your history of plans, Part D plans that you've enrolled in the past or moving forward. It will save your list of medications that you put in when you do a search. It has an electronic health records option that you can give your doctors access to. It has a lot of good features that can be very, very helpful. And it certainly is helpful when you are looking at Part D coverage or enrolling in Part D coverage, because once you create an account, everything is auto-filled in for you when you do an application for Part D. Again, it is strongly encouraged you create an account, but it is not required. You can do anything you need to do with Medicare, regardless of whether or not you have an account. Real quickly, I'm just going to show you some of the primary pages for the Medicare website to help get you routed to the Plan Finder. Here we have a screenshot of the Medicare.gov homepage. And on that homepage, and they redesign it a little bit every time I get on there, but on that homepage, during open enrollment, it will look more like this. Currently, right now, it's going to have some different options up here, but there will always be a button underneath this primary picture that says log into your account or create an account or find health and drug plans. Once you click on that, it's going to give you the option to either log into your account if you already have one, or it's going to give you the option to create an account, or you can continue without having an account, which I've circled here. So this is the login page. And in little tiny writing right under this login button, it says continue without logging in. And if you click on that, it's going to take you to the page. The next page is going to ask you if you qualify for financial assistance, the extra help. It's going to ask you what your zip code is, and then it's going to ask you to start typing in all of your medications. Again, we can help with that. I don't typically do a live demo for that, but we are always happy to help you with that. We can do a Zoom call, walk you through that process, show you that website in live time, or any other assistance you might like to have with that process, or we can answer simply any questions you might have as a result of that process. It is the most effective way and the best way to figure out what Part D plan is going to give you the best value for your dollars, give you the best drug coverage for the least amount of cost. This Plan Finder is geared towards searching Part D costs specifically, but because Advantage plans include drug coverage, it can also show you all of the Advantage plans, what the drug costs would be through the Advantage plans, as well as what the copays for any other medical service under Part A or Part B would be with each individual Advantage plan as well. But again, it's going to list those Advantage plans based on the drug costs from the most cost effective to the least cost effective. So you can look at both kinds of options at the same time. And again, it's going to be the most effective way to find the plan cost that's going to give you the best value, the least amount of out-of-pocket cost to you. Any questions about any of that? All right. Oh, I forgot to take this slide out. So in the past, we've been able to provide a little newspaper handout that has been put together by the Division of Insurance up in Denver. Unfortunately, they weren't able to get that done this year due to staffing shortages. That information is available on the Department of Regulatory Agencies website. And if anybody would like that link to that website, just shoot me an email or type in the chat and let me know. But unfortunately, this newspaper was not available this year. Another good way to get a list of all the plans that are available in Colorado, whether it's Part D or Medicare Advantage plans, is to order a Medicare New Handbook for 2022. The Medicare New Handbooks, the paper handbooks that are mailed to people every year, once they're enrolled in Medicare. So if you're not enrolled in Medicare, you probably didn't get one. But once you get enrolled in Medicare, you'll start getting one every fall, usually just before open enrollment starts. Those handbooks are now tailored to be state specific. So if you live in Colorado, you receive a Medicare New Handbook for Colorado. In the back of that book, it will list all the Part D plans and all the Advantage plans available for purchase anywhere in Colorado. And if you haven't gotten one because you're not enrolled in Medicare yet, you can always call 1-800-MEDICARE and ask them to send you one. You can go to the Medicare.gov website and download the Medicare New Handbook as a PDF, but it's not going to be state specific. So just be aware of that. The only way to get a state specific handbook is to call 1-800-MEDICARE and ask them to mail you one. And I've listed their number here. And that's about it for Part D. Were there any other questions about anything Part D? Again, you can type in the chat box or simply unmute and ask your question. Well, this is the quietest cloud I've ever had. All right. So our office is also responsible, or the agency that is the Senior Medicare Patrol Department for our 9 counties. The Senior Medicare Patrol is the program that is designed to educate and empower people to protect, detect, and report potential Medicare fraud, errors, and abuse. So anytime you have an inkling of a suspicion that maybe Medicare was billed for a service you didn't receive, if you ever have a situation where Medicare denied something that you think they should have paid for, if you have a situation where you get a bill that you don't think you have to pay, give us a call here at our local office, and we can help walk you through that and help you figure out whether or not it's fraud or whether or not it's just a billing error. You can call the Colorado hotline, the toll-free number, and report that as well. That call goes to the Denver office. Or if you wanted more information, you could go to the S&P website to find more information about this program. This program is always looking for volunteers, and this is one of the more entertaining, or it's one of the funner programs that you can volunteer for under the Medicare program. Again, any questions that you have after the presentation, you're always welcome to call us. I've given you our local number, the toll-free statewide number. I've also provided our email. This emails come directly to me. I'm always happy to answer email questions, and that's typically the quickest way you're going to get an answer from me specifically, because I'm not always able to answer my phone or return calls in as timely manner as I would like to, but I'm always able to answer emails. Again, we serve a total of 9 counties. And I guess that's it. Thank you for the comment about the presentation. I do appreciate that. Multiple comments. So I do appreciate that. I'm glad you found that information helpful and easy to understand? All right. Well, if there are no questions, again, if you got the email with the handouts, wonderful. If you did not, please let us know. If you have any questions after the fact, between now and next week's presentation, please feel free to shoot me an email or give us a call. We have a total of 5 counselors and a volunteer who are able to take your calls and answer your questions directly. Again, thank you for the appreciation and the chats. We do appreciate it. And if there's nothing else, I will let you guys go and enjoy the rest of your evening and hope to see you next week for part 4 of our Medicare 4-part series. All right. You guys have a good night. Thank you.